Hi, this is Dr. Jonas Leibowitz, an endocrinologist with 30 years experience, here to talk to you about the classification of diabetes, type 1 diabetes. When a person is diagnosed with diabetes based on sugar or A1C criteria, they often ask what type of diabetes they have. People are concerned about type 1 diabetes. From our point of view in endocrinology, type 1 diabetes usually infers that the patient is somewhat younger. The patient also may be a little bit thinner, although as the population has gained weight over time, a type 1 diabetic may also be a little bit heavier. Previously, when we talked about that subtype of patient, it was a younger patient, traditionally a child essentially, less than 18. But over the last several years, the incidence of type 1 diabetes in the population over that age group, the adult population, seems to be about a 50-50% breakdown, where half the patients are no longer children. And I think people have been surprised by that and just have this assumption that type 1 diabetes is a childhood disorder. And you may have heard people refer to it as juvenile diabetes, but that's a little bit confusing because not everybody's a child. You also may have heard of people refer to this as insulin-dependent diabetes, but that really can't be so because people who have type 2 diabetes need to take insulin as well. So type 1 diabetes is probably the best definition of it. But really what it is, it's an autoimmune disorder. So we make immune cells that decide to attack our pancreas, and our pancreas can't make the insulin it needs to store the sugar. There's probably some patients who are prone to this. They may have family members who have other autoimmune diseases, like type 1 diabetes, or perhaps other things like thyroid or rheumatoid arthritis or lupus, things like that, that may make them prone, and something happens. We're not sure always what it is that happens. It could be a virus. It could be some kind of inflammation or infection that may lead to that immune attack on the pancreas, and the pancreas can't make enough insulin. Usually, the diabetes develops when the pancreas loses about 80% or so of its ability to make insulin. Tests that can help us make that diagnosis include measurement of immune cells. We can measure some of the immune cells that attack the pancreas and see if they're elevated. Also, we may have some measurements of insulin that may tell us if the patient is making enough insulin. This could be tricky though, because like we said before, that patient still may be making a fair amount of insulin. These patients may also be prone to something called ketoacidosis, and many patients with type 1 diabetes of new onset may present to a hospital in ketoacidosis because without having enough insulin, their body may move into the metabolism of fat called ketosis. And therefore, it's important to know that type 1 diabetic patients are really unique in that they're insulin deficient and they're thought to be insulin deficient for their whole lives. Additionally, we have other classifications of diabetes for other disorders, but I think when we talk about things that may damage the pancreas and may make someone prone to type 1 diabetes or needing insulin, I like to use those disorders as well as examples of things that are in the type 1 family, although they're not autoimmune. So if you had your pancreas removed because of surgery, if you've had multiple episodes of something called pancreatitis and your pancreas has been physically destroyed and it can't make insulin, or various infiltrative disorders of the pancreas as well, because those patients similarly aren't making enough insulin in the pancreas, so they're more like a type 1 diabetic than any other type of diabetic.